Singapore had contained the coronavirus outbreak, then cases spiked. What went wrong? In February and March, Singapore was being hailed as a model in coronavirus response, with only 96 cases and 0 deaths by February 28. Now, the city-state is dealing with a spike in confirmed coronavirus cases, growing from 266 to over 8,000 since March 17. Many suggest that the government of Singapore may have overlooked the living conditions of migrant workers and underestimated how fast the disease could spread. On February 28, Fortune magazine wrote that Singapore had contained a coronavirus outbreak in their country through measures only a city-state like theirs could implement. For instance, Singapore has a population of only 5.7 million and a world-class health system that could allow for strict contact tracing and testing methods. They were able to make use of isolation wards established in hospitals back in 2003 when SARS hit. The hospitals also didn't let coronavirus-positive patients go back home until they tested negative, regardless of how mild their symptoms were. Singapore's total area of 700 square kilometers and only major land border with Malaysia also allows the government to easily keep track of who enters and leaves the nation. A culture of willingness to aid a community rather than focus on oneself is thought to have played a role in how Singapore dealt with the public health crisis as well. CNN reports that the Singaporean government failed to test several clusters of their population, including groups of mostly South Asian migrant workers living in crowded dormitories where social distancing is almost impossible. Singaporean lawyer Tommy Koh wrote in a viral Facebook post that these dormitories were like a time bomb waiting to explode, likening the migrant workers to sardines. According to the National Public Radio, the Singaporean government has already put every dormitory housing migrant workers under a near-total lockdown. Dormitories for migrant workers often keep over 12 workers in one room, forced to use only one kitchen and toilet. The lockdown reportedly affects around 300,000 migrant workers. Singaporean Prime Minister Lee Hsien Loong has said that most of the coronavirus cases in the dormitories are mild because the workers are young. He also said that the country needs some time to break the chain of transmission in these living spaces.